Hello, you are welcome to another lecture on epithelial cells. This is part 2 on what I have already talked about. This time around we are going to look at micrographs to help appreciate most of the foundations we have laid so far. Thank you for joining me. So if we want to explain this micrograph, which has been indicated to be simple squamous, we want to look at the dark dotted areas. Okay, so those are going to be nuclei of the cells. The middle portion there is a lumen, so you can see that the layers are more than one. Okay, so that's more than one cell layer. So you remember I told you use the topmost layer, so that would be squamous. When you look at this one, it's more cuboidal in nature. Okay, so the cells are spherical, the nuclei are also looking spherical in nature. So this is a cuboidal type of lining epithelium. Okay, so the insert here also confirms, okay, exactly what we are trying to describe with the micrograph, having cuboidal, more or less spherical nature for a simple cuboidal epithelium. When you look at this very one, which is simple columnar epithelium, you find that the cells are taller than wide. Okay, again the nuclei of the cells are also looking elongated, so that is simple columnar, and it sits on the basement membrane. Again, the insert tells you that that is a confirmation of simple columnar epithelium. We can also see some white areas known as the goblet cells, okay, interspersed within it, and even some brush borders at the apical surface. Remember we said that the apical surface can undergo surface specialization. Then I think a type of epithelium I didn't talk about in my first video was the transitional epithelium, also known as urothelium. This is usually found in the bladder, okay, so the urinary system for that matter. Now they will transit between shapes due to the amount of urine that is in the bladder. So if the bladder is full, then it's going to be more squamous. If the bladder is empty, it's going to be highly columnar, okay, or sometimes you can even have high cuboidal. Okay, so that is what we term as transitional epithelium, because it is transiting, okay, between one shape and the other based on the amount of urine you have in the bladder. So take note of this type of epithelium, transitional epithelium, also known as urothelium, basically for the urinary system, especially the bladder. Right, now you can see that you have stratification as well in this bladder lining. Okay, so you can appreciate that. Now this is an example of the pseudostratified epithelium, which is usually found in the respiratory system. You can see the apical surfaces are having specialization of cilia. All right, and then you also have goblet cells interspersed between the pseudostratified columnar epithelium you see in the lining. As you can see, pseudostratification is based on the fact that many cells, in fact all of them, will sit on the basement membrane, but not all the cells will reach the apex. That is the definition. All right, so take note of that also. And most of these lining epithelia are found in the respiratory system. This is another example of transitional epithelium, and you can see the bladder has been shown, okay, and then projected here to elaborate on how the lining epithelium looks like. In that case, for the transitional epithelium, you can always see one aspect of the shape at a time, because this is not a dynamic picture, it's not a motion picture or a movie, it's just a static picture. So at every point when the picture is taken for transitional epithelium. You're only going to see a particular type of epithelium. Okay, this is another example of a simple cuboidal type of epithelium, and they also have simple columnar at the base, and you have part of the body being shown to actually make the point of the source, okay, where you find this type of epithelia. Okay, so you can see one in the gland that is shown above, and then you also have simple columnar in part of the GIT, okay, shown there. Then also you have this pseudostratification epithelium, and you can also find that you have apical specialization there. So usually in the reproductive system of the female, especially the fallopian tube, you find the upper part of the epithelium there, and then the lower part of the picture here is relating to the respiratory areas. Okay, then for stratified squamous, an excellent example would be the vagina. As I said earlier on in the other lecture, because of coitus and the abrasion that may occur due to sexual intercourse, the movement of the penis in and out will require that the vagina becomes stratified squamous to be reinforced. Okay, despite the lubrication that will also reduce the friction, you still need some strength in terms of stratification. So the vagina is a perfect example for a stratified squamous epithelium. Thank you very much, and I hope this helps in your studies. Hope to meet you another time.